Alright, welcome back. This is Health Matters with me, Dishen Kumar. And earlier we had a very interesting conversation with Dr. Shahnaz about migraines. Now, migraine is something that is affecting a lot of people. 1 in 7 people in the world is affected by migraines. But today, after talking to Dr. Shahnaz, it's important for us on Health Matters to actually talk to you or show you a perspective from a patient, a person who actually suffers from migraines. So today with me is Puan Kimi. Thank you, Puan Kimi, for joining us today.
You're welcome.
Okay, Puan Kimi, let's start off with a very quick question. Everybody's watching this, they're going to ask, why are you wearing those dark glasses?
Okay. I'm wearing the glasses not because I'm an artist or it's because I don't like people to see me, okay, or I don't have eyes. I do have eyes. It's just that it's because I am suffering from photophobia. Some may have heard of it, some may not, but it's actually a type of migraine triggers. Yeah, so I am actually a patient suffering from migraine, and I suffer from photophobia.
Okay, and when did this when did this issue or the symptoms and this disease actually start?
It's about 2 years ago. Yeah, so back in 2017, I still remember the date, September 21st. I fainted at work. Without any cause, without any reason. I was not having any fever, I was not having any chest pain, nothing, but I just fainted at work.
Okay.
Before that episode, I happened to had a very sharp, painful sharpness here, headache, okay, at the back of my head, as well as my right eyes are about, I felt that it was about to come off, it was about to drop off. So I told a friend, I think I'm about to faint. And the next minute I realized, I woke up, I was in an ambulance. I was about to be driven to a nearby hospital. Yeah, so.
There was no symptoms, no reaction whatsoever?
No symptoms, nothing that I can track or understand that it was migraine back then. Okay. But the only thing that I know is that it could be something that I have undergo before. I was just telling myself that simply because about 11 days before that, before I fainted, I was warded for my chronic menorrhagia, which is a type of excessive bleeding via my menstrual. So I was hospitalized, some treatment was done. And of course, I'm not denying the fact that since I was discharged for the 11 days before I fainted, I had been having this uneasy, giddy, dizzy feeling.
You already felt like something is wrong.
But I cannot tell myself what went wrong. I was just thinking that maybe I don't have enough rest from my hospitalization because I go back to work straight away for 2 weeks. So only then, when I fainted at work, the doctor just diagnosed me with severe headache. That's it, and I went back. But the next day, after 24 hours exactly, similar episode happened again. I had the same terrible headache and pain on my eyes, and then I was hospitalized again. So the whole episode of the second hospitalization then brought me to the diagnosis of how I contracted migraine.
Okay. Yeah. So now the diagnosis part, how did you finally realize that you actually had a severe problem?
The severity comes about when I realized that every morning as I watched the sun rise, I had a pain trigger at the back of my head. So it's telling me that something is coming, something is not right. Close your eyes. Yeah. So, but I tried to fight it, stupid me. I thought I was trying to understand my body. And when you fight the lights, that's when you get the sharp pain and then you get migraine. And I'll end up taking medication and sleeping the whole day because you don't know how to react to the pain. Yeah. Only when after a few trial and error with my doctor, so then we concluded that it's actually the side effects of the contraceptive injection that I took, but we're hoping that it will go away after the 6 months duration.
So the contraceptive medicine that you were taking, that actually caused you to actually have?
Only 2% of the people in the world may had a terrible side effects from the injection, and I happen to be one of them. But the severity goes into not just dizziness and giddiness or vomiting. In my case, I never had that severely, but it straight away goes into migraine.
Okay. Now, you have been diagnosed. When you got the news, how did you actually feel? Did you feel, I knew it, or did you feel like it's not fair?
I think the later one. Yeah, it's not fair because throughout my entire life, I was then already married for more than 18 years. Never took contraceptive, okay, being the very orthodox kind of life, we thought that let's things be natural, and a kind husband who supports me to say that he can control everything. And to know that I got that from the contraceptive injection made me thinking that how fair it is, okay, to stop one problem then to get another problem, okay. But there's only one consolation. After much struggle for 4 months, the only consolation I think is the fact that my wish come true, which is to actually be home. So leaving job after the 4 months of suffering, on one hand side, of course it's a pain because you lost the ringgit amount, okay, every month. But on the other side of the life is that you now get to be really applying that balance of life. Yeah, so that's the only consolation that I try to take away with me even until now after 2 years. That state of denial is still there, but I'll try to see it in a positive way.
Now, how difficult was it for you to actually, I believe you actually went to work wearing the glasses.
Yes, I do.
How difficult was you having something like that and then try to go out and have your own life? And
I think the challenge is being in my position then as a manager heading a unit, right? And winning people is not easy because you lost that convincing power, okay? You lost that connecting power because people cannot see through your eyes anymore. So if you don't mind, I will just open this. You see me now, you feel better, right? You feel that, oh, she's friendly, she's okay, she's alright. But sorry, the lights.
Yeah, it's okay, no problem.
But you see me now, how do you feel?
You're reserved.
Reserved,
can't
in
really connect with
control.
the person. Yeah.
She just wants what she wants. She needs to win. So those mindset will come in, right? So that is where the challenge come about at work because I work in a unit where we interact a lot with, especially the internal customers, and to convince each of the head of the department to agree to what you plans to do is not easy. And having a challenging of opinion superior add-ons to your pain, okay, in work, because if you don't, people don't like your superior, people don't like you, okay, that's the whole thing about corporate world. So adjusting to that is very hard, and I think before things goes wrong somewhere and I'm being summoned to be one of those naughty kids, okay, or the discouraged few, okay, whatever term that they call it, then I decided that as much as I don't want to, but I think that's the best for me to actually leave job in order for me to get better.